Hello, good evening. My name is Vernon Maniago, and I'm here to present my stakeholder educational plan in my Transforming Healthcare Through Outcomes Management class. So, a little bit about myself. I am a nurse practitioner in adult acute care. I've been in the practitioner world since 2016. I, uh, my primary goal right now, my primary setting is in corrections. And I've been in corrections as a nurse practitioner since 2018. And prior to that, I was a registered nurse for the VA um, for about 12 years. So, in this setting, it's located in Henderson, Nevada. It's a small jail. We house about 250 to 300 inmates at a time. Sometimes they're locally from Henderson, or sometimes they're ICE patients, which stands for Immigration Customs Enforcement patients that are awaiting their trial for deportation. So we see patients that have chronic care, diabetes, hypertension, high cholesterol, and of course we also have the acute care stuff, with cough and cold, congestion, fights, minor injuries and all that. So my goal is basically to concentrate on the nurse burnout and the amount of burnout that's actually not being talked about, especially since COVID-19. COVID-19 had a lot of nurses, including myself, to the point where we experience depersonalization, cynicism, to the point where we have no point of working. So there's a study that showed 1/3 of nurses experience burnout. They work more hours due to overtime, and guess what? The cycle of burnout continues when we have short nurse shortage. In the jail setting, it also leads to the matter of role ambiguity, because you have the role as a nurse, and then you also have to conform to the safety within the jail setting. Some of the signs that you may experience with nurse burnout could be low immunity, leading to more sick days and sick calls. Also, the emotional signs are like lack of motivation and detachment. And it may lead to, again, like I said, cynicism and like being frustrated while being at work. So the stakeholders that I'm addressing now is, of course, the corrections management, the lieutenant, sergeants, lieutenants, and then captain, and of course the HSA, which is our health service administrator, who's also an RN, and our DON, which is the director of nursing, to basically be involved so they can understand and pretty much notice who the nurses that they may need to be addressed, as far as for if they're having burnout. And because sometimes the nurses won't tell you if they're burnout, they're just there to work and get a paycheck. So the nursing theory that I researched was based on the jobs demand control and support. Was developed in 1979 by Robert Karasek, and it's basically an acronym. J, the job demand, is how demanding is the work around you. Do you have control, and is there enough support with the organizations? Because otherwise, if you have more demand, less support, and less control, you tend to have signs of burnout and work strain. So the model also helps demands cause the stress from employees, such as the heavy workload, the role ambiguity that I mentioned, and that leads to job strain. So the goal for what I want to talk about is what can we do to manage the stress before it gets out of hand. So the educational intervention I'd like to talk about, it could be an intervention with breathing exercises, meditation. But I researched a cheaper version because mindfulness basically it was researched, had multiple research regarding the usefulness with stress and people with mental health. And basically people were using mindfulness based strategies where there was a coach that will go to the organization and basically have 2 hours set aside a week for about 8 weeks to help develop strategies and perform meditation and yoga within the premises. But in this small gel, it makes sense to use the mindfulness coach app, which is free. It was developed by the VA to basically combat the rise in PTSD among our veterans. So the mindfulness coach app, you can basically download it in the phone or your smartphone, or we can also download it into one of the rooms designated for quietness and meditation, which is the mindfulness breathing app. The benefits, basically, at the moment, you have control. You listen to your breaths. You basically at a calm natured position. You improve your concentration. It's known to also have a person develop emotional intelligence and improve their well-being. So what the stakeholders can do to facilitate is basically to support and understand that, especially in this setting, there's not a lot of research regarding the mental health well-being of nurses and staff. There's studies for correctional officers, but very minimal for nurses. And that's why while I was working at the jail setting, I noticed the high attrition. There's a lot of turnover and not a lot of strategies or any mindfulness place where they can relax. So basically, I see nurses just walk in, get a patient, and leave. So basically, the organization support is very, very important. So I'd like to implement, of course, the costs will basically cost, say we have 2 nurses, 2 LPNs for each shift, Sunday, Monday, Tuesday, and then 1 RN working in booking. And then we also have nurses at the B side, which is the other end, second half of the shift, that work 3 days, Thursday, Friday, Saturday. I'm not gonna mention the nurses that work on Wednesday because they're per diem. So just basically the nurses and LPN, the RN and LPN that work from Sunday, Monday, Tuesday, and then Thursday, Friday, Saturday. And they work 12-hour shifts. So by allowing them to perform mindfulness coach app for about 5 to 10 minutes, either on the phone in a separate area where it's quiet, before they chart it or before they see the patients, they can actually start, doing this breathing exercise where it prompts you to listen to your breaths, take deep breaths, listen to your breaths, exhale and inhalation. So I'd like to be the facilitator as a DNP student performing this during change of shift on the A side, which is like the first half of the shift, and then B side, which is the second half of the shift for the week. And I would like to use a Maslow burnout tool where, the nurses that are involved will perform it, do the tool, the inventory tool, see what level they're as far as for the stress level, and then perform the mindfulness for about 8 weeks every day while they're at work, and then do another one and evaluate their basically the results. So like I was saying, with the indirect benefit, the value of this is resulting in cost effectiveness as a result of decreased worker turnover and fewer sick call days. there are studies that shown that there was increased job satisfaction and engagement and motivation that basically can lead to a positive working environment and relationship and improve retention among the staff. And of course, as we all know, it takes 2 weeks for training for someone to get on board. And I've seen that a lot of nurses would come in on board, train for about 2 weeks, and they decided it's not for them, and you know, they leave. So that's a lot of costs that incurred, but from the organization, and of course the facility itself. When you have less nurses to collaborate with the officers, again, it's a lot of collaboration, seeing the patients, especially for like the LPN, the licensed practical nurses, where they have to do pill call, but also have to await an officer that's available so they can be present while performing the medical duties. So I also, like, as a student, would also update after I would be available during shift change for the nurses to actually be able to ask me questions, and also to report to the DUN and HSA. So again, basically, the leadership may facilitate, the process, innovation, and knowledge sharing by providing organization support and buy-in through transformation leadership, and to improve a healthy workplace and improve communication and well-being of the nurses. Okay, well, thank you very much. Bye.